Hey guys, my name's Desiree and I am officially 3 days post-op from a tummy tuck. I'm here with my boyfriend Ethan, who has been so sweet to help me with my recovery. And a lot of people have been asking questions on how to properly drain these drains and just kind of care for the incision and everything. So we're going to make a quick video to show you guys what we're doing for my smooth and successful recovery.
All right, what's going on, guys? So first off, we're going to start with, we're going to undo her garment, and I'm going to take her drains down and put them down and show you how to remove the garment that her doctor prescribed her. Okay, so her doctor gave her these like fancy little alligator clips to hold the drains in place. And be careful, you know, maintain some decency here. And then unclasp the top of the garment. Then you come around here. Hers has zippers down the sides, and then it unclasps kind of like a bra, little like clasps here. Help. I'll show you how not to do it. And then you see we're right over here over the incision, so you gotta be a little more careful here. Alright, so there's that one. We'll pull shirt down, make sure she's covered up. And the other side is the exact same thing. One thing that's cool about this garment that her doctor gave her, so that it has this for the shoulder straps, you know, both sides, kind of like a bra would have. But her doctor actually had these custom made. Right here where this little flower is, there's actually another loop in the middle. So instead of this hook coming here on the shoulder, we actually, he told us to bring it in here to the middle, because a problem that a lot of people have is this will fold over. This part, if it's clasped here, nothing's holding in the middle, so this will kind of pooch over and fold. And that's what creates this crease right here. Especially, he said it was especially important after liposuction, which Des didn't have. But whenever this pooches up, it can cause like a crease while she's sitting, and that can leave an indentation and cut off the blood supply in the stomach flap, which actually like basically hurts the chances of healing and slows the healing down a lot. So ask your surgeon if at all possible, or figure out a way to rig it up to where you have a strap that's holding it up in the center rather than just on both sides. And after that, we've already got it all undone. So we'll pull it down here and fold it over. And now we've got our dressings. All right, so with the incision, it's actually painful and kind of not dangerous, but it does put some unnecessary stress on the incision whenever she gets in and out of bed and she like has to twist to bring her legs up and all that. So what we're going to do is, now that we've got the garment on, we're going to drain the drains. But first, in order to make sure that everything is done and kind of just work efficiently through the process, rather than having her go drain the drains, come climb back in bed, get situated, remove the bandages, and then go back, what we're going to do is remove the bandages. We're going to get her out of bed. We're going to go over, drain her drains, and we're actually going to pull the garment off, and she is going to hop in the shower. Today is her first shower. It's day 3. Surgeon instructed her today was the day she could go back to showering. So I'm going to go toss this in the washer while she is showering. That way it can get clean. Nobody likes getting out of the shower and getting back in dirty clothes. So what we're going to do is make sure this is clean and running while she's in the shower. That way we're kind of moving efficiently through it. So now we're going to remove the bandages from the incision. You want to pull really slow. Sometimes the stitches can be sticky. You see there's very minimal blood, which is good. So you just want to pull very, very slow. Sometimes it can stick. And if it is sticking, it could potentially be a scab. Wow, there is no scabbing. And you don't want to rip the scab if there is a scab, because that's what can begin to cause or worsen the scarring. Unreal. Minimal bleeding, minimal bruising. It's starting to bruise a little bit. Just around whenever the surgeon was putting it together, he was using clamps to hold the flap in place while he started his sutures. And that's honestly the only thing that's bruising. Actually, this is the only spot even that's really bruising is right there. Everything else all the way around doesn't really look to be bruising. So what we're going to do now, just discard the bandages. But we're going to work on getting her out of bed now. We're going to go drain the drains and actually milk the tubes to try and make sure everything is clear and patent and we're getting, good fluid out. This is actually the first time we've drained them today. She's not putting out much fluid. She's been up, she's walking around, she's very mobile. Y'all seen her on Instagram. She's in the kitchen, she's cooking, not lifting or bending over or anything like that. But she is up, she's doing things, she's being active. But we did go to Walmart today because last night while she was asleep, very, very little, less than 5 milliliters came out. We went to Walmart and walked around for a while, and that gave her quite a bit. I mean, within probably 3 hours of walking around the store, an hour and a half, 2 hours of walking around the store, we came back and she had 20 to 30 more milliliters of drainage. So being up, that really promotes healing, it promotes circulation, and it helps out a lot. So definitely listen to the doctor and stay active. It's going to help you heal up faster. It's going to help everything just move along more smoothly. So now we're going to focus on getting her up and getting her over, and we're going to drain the drains. All right, so we're in the bathroom. We're going to drain the drains now. So this is a JP drain, Jackson-Pratt. You basically squeeze it and cap it right here, and that causes it to pull suction because it's trying to open back up, but it's a closed system now. So while it's trying to open up, it also has this tube, which is running up inside of her. That is now being pulled against, and that's the suction that brings the fluid out. So what we're going to do is drain these now. Just like I said, you have this little cap, and you open it, and it releases the tension. You get that wide open, it kind of looks like a hand grenade. And then you just bring it over to the toilet, and just squeeze it down flat, and then you just place this little stopper right back in, and you're done. Alright, so one thing that's really important, occasionally you can see in this, it's kind of getting some almost clots. It's not really clots, don't freak out and worry, I know clots are dangerous. It's not actually clots, what it is just chunks of the blood tissue that have come out. So what's really good to do is put a little neosporin on your fingers, a little antibacterial ointment. It can be mupirocin, bacitracin, bactroban, whatever it is. But put a little of that on your fingers and start at the tip, right up, next to the body where the wounds come out, and you just kind of massage it. So you'll just work your way. It's important to not pull against the body itself, but you're just going to work your way down and kind of milk it and just bring the tissue down. That way there's nothing clogging. Make sure it's broken up. And you're just going to bring it down and squeeze it, and it'll come out into the tubes again. Alright, so we got her back in bed. We have the garment back on her. Just got it out of the washer, cleaned up. Now what we're going to do is take some, like that, neosporin, and we're going to, I got gloves on again, we're going to apply it all to the wound, or incision, as well as the belly button. So we're just going to do that. Apply it pretty liberally just to make sure it's fully coated. You want to make sure that everything stays wet. This is what helps prevent scabbing, which in turn helps prevent scarring. You keep the incision nice and wet. Keep the incision nice and wet. That is going to help it from scarring. And then Neosporin, of course, is antibacterial, so it kind of helps as another line of defense to keep it from getting infected, which nobody wants. Like I said, just pretty good size little drop. You just lightly coat everything. We just gave the last round of pain meds and antibiotics for the day. I don't know if you can tell on the screen, but it's really pretty thickly coated. I mean, you want to cover everything, just because, like I say, the wetter the better. And that's also going to help with, fighting off bacteria. as well as holding the bandage in place, because you're not using any tape or anything. So what this is going to do is actually, cause the bandage to stick to the skin. Okay, that's going to be it. And then I'll do it around the drains insertion as well. They're a little low down, a little, private, so we're going to do that off camera. But after this, I'll be right back and show you the actual bandaging part of it. Alright, so for the dressing, basic, we're just using 4x4 gauze pads, unfolding them into 4 inches wide, 8 inches wide. They're like 4-ply, so unfold them like this, and then you just apply. Literally as simple as this. Make sure the full thing's coated, put it on, and just make sure that it is touching. Like I said, the neosporin will hold it in place, and then you want to overlap them as you go. Stops there, stops there. Alright, cool. Plenty of coverage. Alright, and then the same for the belly button. And then for the drains is actually going to be a little bit different of a pad. These are kind of like a tightly woven pad. These ones are like the, what is it, like a non-stick. They're not going to stick to the wounds. They're like a quilted type material, I guess you would say. And then the ones we use for the drain are a little bit different. They're more of like the typical gauze, kind of like fibrous. What you do with those, take your scissors and cut those about halfway or so through, like that. And do you want to show?
Sure.
Okay, so on that, we're going to have to be a little careful here. We can maybe do some blurring. You see the drains are coming out of the top of the pubis. What you do is you go under the drain, and this allows you to wrap it around it. What we're doing, I'll go ahead and do it, and then we'll check back in and show you in just a second. Alright, so like I was saying, they are actually cut, so you bring them under the drain from the bottom, and then you have the cut part, and you kind of just wrap it around. These have neosporin around them as well, so you just bring that, and that kind of gives you that kind of coated to cover everything up. This is going to be our final, I guess, dressing before we bring this up and close her up.
Okay, so there you have it, officially day 3 post-op, all set. Got to take my first shower. This is pretty much what I've been doing, laying in bed and recovering. Just trying to follow all the rules, really, take your medicine, don't lift and bend, put your neosporin on, use gauze, ask for help. That's been the #1 thing for me, is I need help getting up, and I need help, when I can't reach something.
I love it. It's really that simple, y'all. Like, it's just a list of things you have to do every day. Like, take your medicine 4 times a day, whatever it is. Like, changing the dressings, the neosporin, stuff like that. Like, just make a list, like, in your notes app. Like, it's just checking boxes off of a list. It's not something new that you have to do every day. Like, it's
True.
the same thing day in, day out. It's really simple. And, the more days into it you get, the easier it gets. So therefore, it helps everything kind of come together. Nobody's perfect when they first start out. You're going to kind of learn easier ways, tricks, whatever, as you go along. But that's the process, is just making sure you're doing the right things every day, and you're going to get better at them. You don't have to be a nurse. You don't have to be a healthcare professional to be able to do this. You just have to know what the things to do are and go through with them.
And that's why we're documenting all of this for you guys. So whoever's watching this, if this is something you're considering in your future, if you're on a weight loss journey and you want to get your body snatched up, now you have videos and you have all of this advice and steps you can follow for yourself. And that's why I've been so open to sharing so closely my experience. I mean, you guys just saw a whole lot of me, more than I thought I'd ever share with the world, but I hope that it helps you. That's my intention here. So anyways, while you're thinking about it, go ahead and give this video a like and subscribe to my channel so you can continue on with my journey to tuck.